3 decades into the global AIDS epidemic, people who inject drugs and prisoners are still disproportionately affected by HIV. The number of new HIV infections among people who inject drugs increased by 33% between 2011 and 2015, while the epidemic has generally stabilized among young people and adults. Similarly, evidence shows that prisoners are 5 times more likely to be living with HIV than adults in the community. Along with tuberculosis, AIDS is a major cause of death among prisoners in many countries. Yet, the coverage of HIV prevention and treatment services for people who inject drugs and prisons is poor. Only 1% of people who inject drugs live in countries with adequate coverage of essential services such as needle syringe programs and opioid substitution therapy. For women who use drugs and women in prison, the lack of access to HIV services is even more pronounced. UNODC is a natural and trusted partner of the drug control and law enforcement agencies, prison authorities, and the justice and health sectors. When dealing with drugs, prisons, and criminal justice, countries have for the last 20 years sought guidance and technical assistance from UNODC. Due to this unique advantage, UNODC in 1999 was invited to join the UNAIDS family as a co-sponsor to lead the HIV response for people who use drugs and people in prisons. All these factors puts UNODC in a favorable position to support member states and civil society organizations to address HIV as it relates to drug use and in prisons. The global community already missed the UNGA's target of 50% reduction of new HIV infections among people who inject drugs by 2015. Therefore, it is obvious that to meet the SDG target of ending AIDS as a public health threat by 2030, we must do business differently. For example, national drug control and law enforcement agencies, prison authorities, and the justice and health sectors need to talk to each other and engage with civil societies and communities to make sure that their policies, strategies, and practices are harmonized and based on evidence and human rights, and support urgent scaling up of HIV harm reduction services for people who inject drugs as defined by WHO, UNODC, and UNAIDS, and also support comprehensive HIV services for people in prisons as defined by UNODC and its UNAIDS partners. Finance ministries need to be on board too, to make sure that adequate sustainable funding is available to implement priority interventions. We need to do a better job of explaining to them that these services are value for money and that it's about investing now to avoid paying a lot more later. We also need to make sure that services are gender and age responsive and protect the human rights of these communities who live at the margin of the society. Finally, policymakers should have a close look at who are being held in prison, why they are there, and for how long they are being detained. Various alternatives to imprisonment should be considered and used to deal with people who use drugs and who commit petty nonviolent offenses, including minors and women. As we have seen over the last 3 decades, HIV does not discriminate whether one uses drugs or is in prison, but people do, which is why we must protect the right to health of the most vulnerable, including people who use drugs and people in prisons.